Cannabinoids and long COVID. Do they help prevent it? Do they help treat it? Hello and welcome back to the Canna Education channel of CV Sciences. I'm Lex Pelger. These are the fine products of PlusCBD. And on the subject of cannabis and long COVID, I'm only aware of 2 reviews and 16 papers on the subject. And one of those is a case report on psychedelics that I'll share at the end. Plus, there's a lot on the loss of smell and treating that with PEA. So for now, I'll share the basics of what we know, but I'd love to hear your experiences in the comments. With long COVID being such a strange malady and with everyone reacting differently to cannabis and cannabinoids, your stories are the best source of data, and not only do I find them fascinating, I think you can help other people as well who are reading these. So, last housekeeping is, we lost this account at 80,000 followers, so follows and likes and interactions are very much appreciated, and check out the link tree for the fine products of PlusCBD, as well as my comprehensive cannabis science newsletter that comes out for free every week. And if you really want to be a pal, subscribe on YouTube and send us love there, because that's a place that doesn't ban this kind of content. So, thanks for your help, and as always, on Cannabinoid Science, ask me anything. So, this review is the best one I've seen, and it answers your questions about cannabis preventing long COVID. Since there's a good bit of data supporting the idea that cannabis users have a less severe run of COVID, and since less severity is linked to less chances of developing long COVID, it would make sense that cannabis users would be less likely to get long COVID. But as far as I know, no one has ever looked at that question. I also imagine it would be a difficult one to study. So, in any case, there is a lot of data on cannabis and acute COVID, and I'll cover that in my next follow-up video. And not all of it is good, so keep an eye out for that if you're interested. So, for long COVID, these researchers said, and I quote, "Cannabinoids have shown promise in treating symptoms associated with post-acute long COVID-19, including depression, anxiety, post-traumatic stress injury, insomnia, pain, and decreased appetite." However, when you actually read this paper, which is free online, you'll see that basically they say that cannabinoids help all those things, so probably they'd help in long COVID patients. But it hasn't been studied in long COVID patients for any of these things. So if you're interested in those symptoms, this paper is a good collection of research, but it's all about that specific condition and not about long COVID as a whole. Similarly, there is this review about cannabis for the neuroinflammation of long COVID. And while they have pretty charts, which I always love, about how cannabinoids help with neuroinflammation, which is one of their most proven properties, all of that data comes from other conditions, not long COVID patients. So, with this situation, you have researchers like our father, Dr. David J. Nutt, who got kicked out of his job of heading a UK drug commission for saying that taking MDMA was roughly as dangerous as riding a horse, and colleagues like him calling for more open-label studies of cannabis for long COVID. So, you do have small safety studies like this, where they found that in long COVID patients, at least a high CBD, low THC oil was well tolerated and didn't cause any harm. The only clinical trial in humans I'm aware of is funded by a hemp company out of Colorado, and in 15 people, their personal blend of CBD-rich hemp extract worked to improve symptoms. But so did the placebo, because apparently their placebo was a bunch of terpenes in hemp oil, and that still helped because terpenes are rad. But I have no more details than that because this article is locked behind a paywall, which is odd when you think that a company who would want their data that they paid for to be out there and freely available, but so it goes. The gods of open access do not appear to us all. So, PEA. The next cannabinoid to look at is PEA, the endocannabinoid found in almost every cell of our body and known for its anti-inflammatory effects as well as its safety. It's also found in a few of our products as well. Bling! In this study, the researchers performed a retrospective cohort study where they compared 2 groups of people with long COVID. Those who had accepted a treatment of 1,200 milligrams of PEA per day for 3 months against a similar group who did not accept that treatment. The patients receiving the PEA showed a greater improvement in depression and fatigue scores. Interestingly, patients with worse baseline scores were more likely to benefit from the PEA treatment. As an explanation for these benefits, the researchers mentioned the growing evidence of an association between the persistent fatigue following COVID and systemic inflammation, making it tempting to speculate that the observed beneficial effects of PEA on fatigue might be at least in part be explained by its known anti-inflammatory properties. So, in another study of 33 long COVID patients, 600 milligrams of PEA for 3 months substantially improved their symptom scores on the post-COVID-19 functional status scale. And then in another retrospective study in patients with brain fog from long COVID, they compared 26 people with a normal course of treatment to those who also added 700 milligrams of PEA plus 70 milligrams of luteolin, which is an antioxidant flavonoid that is often paired with PEA. And as someone who follows this science, I would say that probably half of all the PEA studies out there also pair it with luteolin. So this is something you see commonly. It's an easy thing to get online. Out of these 26 long COVID patients, 16 reported a reduction of their symptoms, 5 reported a complete remission, 4 reported that they remained stable, and only 1 reported worsening symptoms. You also have a similar case report of that same combo of PEA and luteolin helping with COVID-related neuropathic pain and a nerve injury of the upper arm. Also, for the loss of smell that can occur, one strong study used a double-blind format in over 200 patients with persistent COVID-19 olfactory dysfunction of greater than 6-month duration. The researchers found that the usual olfactory training did help them some. PEA plus luteolin worked better than the training, but best of all was a combination of the PEA and the luteolin and the olfactory training. And in fact, here's a meta-analysis that includes 5 other studies covering 441 patients that found the combination of PEA with luteolin demonstrate a significant efficacy in the overall recovery of the olfactory function compared to the conventional therapy. And at last, for the thing that probably some of you have been waiting for, that psychedelic case report. Here we have symptoms of long COVID being improved by taking a combination of MDMA and dried golden teacher mushrooms. After 1 gram of mushrooms, the patient subjectively reported a 20% improvement in her depression, fatigue, joint pains, and headaches for 7 days. Then, a few weeks later, 125 milligrams of MDMA with 2 grams of mushrooms, she lowered her symptoms of fatigue, depression, anxiety, joint pain, and headaches. The patient was able to return to work and her cognitive function improved, allowing her to resume her PhD studies. The patient's insomnia also improved and she was able to stop taking antihistamines. Overall, she reported an 80% improvement to her condition. And every few months, her headaches would start to come back, especially after she got a flu. But another session with 2 grams of mushrooms would do the trick, and she finally reported a complete resolution of her symptoms. So, get creative and ask me anything.